Hello everyone, my name is Shaylee Mosier and this is my PowerPoint presentation on mandatory vaccines. The background on mandatory vaccines. Vaccines have been used since the 1800s. Smallpox outbreak is what established mandatory vaccinations for children. An outbreak killed thousands of people, turning the government to forcing mandated laws of vaccination. The government decided that it was more important to apply vaccination laws that at that time to prevent further spread of the disease. Many different governments around the world decided to relax those laws after the smallpox crisis ended, while others remained to enforce these laws. Government standards placed. School vaccination requirements are implemented. They are mandated in the United States in order for children to attend school districts. The issue: individual rights versus protection of the public health. This is the main issue in today's society for the fight against vaccination and anti-vaccination. For instance, in 1922, the state of Texas versus Rosalind Zocht. This case dealt with a girl her parents refused to vaccinate her with the smallpox vaccine. After failure of the parents to provide proof of vaccination, the child was excluded from school. They took this case to the Supreme Court, who later ruled that the school was within lawfulness of the state of Texas because it was within the police power of the state to provide for compulsory vaccination. So the main issue with vaccines is that people feel as if it should be a right whether or not to vaccinate their children, but others believe that they do not have the right to say whether or not the children should be vaccinated because they're scared that diseases could return and they could cause illness and death to many. Anti-vaxxers have some common assumptions towards vaccines, like autism, no longer needing the vaccine due to modern medicine and not having outbreaks anymore. Harmful side effects is another one. In the news today, measles outbreak in the United States is currently going on right now, and it's causing a major uproar about vaccines. There have been 22 different states with confirmed cases of measles. The number of cases are increasing each week. Measles were originally eliminated from the United States in 2000. In 2014, we've seen an increase in the measles again, and then it went down again. But now it has gone up, and they believe it's going to be higher than it ever has been this year. Why are the measles coming back? Increased number of people bringing it back from overseas, leading to increased amounts of unvaccinated people in the United States because of anti-vaccination people who are against vaccinating their children. MMR vaccines are encouraged by the Centers for Disease Control in today's society to prevent further spreading of the disease. Recently, they have come out saying that if you were born before 1989, that you can go in and to your PCP's office and get yourself another vaccine of MMR because you have only been given one, and also always encouraging children to have their vaccinations. Kansas school required vaccines, DTaP and Tdap, diphtheria, tetanus, and pertussis, total of 5 doses. Hepatitis A is a new vaccine that's required this year in the 2019-2020 school year, and it requires 2 doses. Hep B has 3 doses. MMR has 2 doses. This is also another new one for this year. Meningococcal is the meningitis vaccine, required 2 doses, and it is also a new one for 2019 to 2020. IPV, poliovirus times 4, and varicella, which is chickenpox, times 2. Some other recommended vaccines are the HPV, the human papillomavirus, 2 to 3 doses depending on when the child starts the vaccine series. Also, they always encourage an annual influenza vaccine, and that depends on what their age is and if they've had previous doses in the past. Some adverse outcomes. If looking at this chart, you can tell that after vaccines were started, for measles and pertussis, tetanus, polio, that you can tell that they definitely showed a decrease in the amount of cases and the amount of deaths that had occurred. Actually, some of them went completely eliminated, and some of them were very close. But due to the increasing rates of unvaccinated children, the number of these that were once nearly eliminated or close to being eliminated have started to reappear. As you can see here with the measles vaccine, it's going up again because there are becoming more cases of it. Nursing and vaccinations. Patient counseling is always a number one thing nurses can do to help with education towards vaccinations. They should be able to give at least general information. Many times the nurses in clinic settings, which I am in, I am required to know a little bit more about the vaccines that I'm giving so I can give the proper education to the parents about it. Improving access to vaccinations. Nurses can work with their communities to help bring more availability to vaccines, working on different clinics and outreaches and how they can help get into the community and provide these vaccines. Nurses can also help by maximizing office visits, clinic nurses preparing and properly understanding what vaccines each person needs prior to them coming to their appointment is very helpful to know, to allow the doctor to know so they can discuss it with the patient and the parents, as well as the nurses to know what they're giving. Using combination vaccines, allowing for less injections and making patient feel less worried about the amount of vaccines needed due to the combos. It's much nicer to tell the patients that you don't have to do as many because they're all put in one. And also utilizing the EMRs and the best practice advisories that come across these now, paying close attention to alerts that come across the charts saying that patients are due for certain vaccines. Some solutions. Enforcing vaccine compliance in school districts, I believe, could be some very good solutions. One of the ways I think this could be done is school responsibility to inform parents and the students. And step 1 would be send a letter home to the parents of the student that is not properly vaccinated, reminding the parents of the needed vaccines. Step 2 would be a second letter sent home to the students with the immunization record and appointment information that has been set up by the school, and a list of the required immunizations that are highlighted so they know for sure what they need to go in and get. Step 3, the third letter is sent as well as telephone calls for follow-up to ensure that these vaccines were given. We need to be a little bit more strict on what we're doing with vaccines in schools. Informing the public of importance of vaccination through different methods in a respectful way. This is a very touchy subject in today's society, so it'd be a very good idea to make sure that we go out and talk to the public in a way that they understand and be respectful about it. Implementation of new vaccine exemption laws. Revision of state exempt vaccine laws that include medical. So all states allow a medical exempt for patients and children to say no, they can't have or do not want the vaccines. There's 48 states that have religious exempt laws, and then philosophical, there are about 20 states that have this. In conclusion, vaccines can prevent the further spread of diseases. It has been shown. Mandatory vaccines are implemented in the United States for children to attend school. Very important to prevent the spread, especially with children being so close to each other in school. The amount of unvaccinated people has increased over the past decade, and in return has caused an increase in the reappearance of previously eliminated diseases, such as today, like in New York, where we're having a crisis with measles here in today's world. Nurses have the opportunity to properly educate, promote public health, and be involved in their communities about mandatory vaccinations. We always can lend a helping hand in this type of situation. These are my references, and thank you for listening.